Hi everyone, for June, which is Migraine and Headache Awareness Month, I'll try to post more videos on the topic. This is one of these videos trying to highlight Dr. Rantal's amazing research. He's based at Harvard. He's the director of the Brigham MGH Headache Center. He was one of my mentors during fellowship. But especially at ECNI, the Headache Corporation of New England, of Northeast Spring 2026 conference, he talked about his research on the neuroimmune trigeminal meningeal interface as a therapeutic target for headache disorder. So what does that mean? So part of his research, which is publicly available online too, is mapping the trigeminal nerve cells. So the trigeminal nerve, which is the fifth cranial nerve, it's the main nerve responsible for sensation in our face, but also deeply involved in migraine mechanism, in the pathophysiology of migraine. And beyond the bodies, the cell bodies of the trigeminal nerve, the trigeminal ganglion, mapping the trigeminal nerve cells has enabled him to better understand the network of how these cells interact with each other, and including with the meninges. So trigeminal nerve is the main nerve responsible for the sensation of our face, but also involved in migraine, and meninges is the lining of our brain where we can also feel pain, and when there's the blood vessels and also the cerebrospinal fluid, the fluid that is cushioning our brain and has many functions too. So he found out doing this mapping that the trigeminal meningeal afferents, so there are branches from the trigeminal nerve that branch to the bone marrow in the skull, and that these branches, these trigeminal nerve branches, are close to the leaky vessels. So there is a path for a trigeminal nerve to be really close and sensing input from blood vessels that are in the meninges, and that would actually explain, or at least partly explain, the link between systemic inflammation that we can see in our blood and triggering migraine through this meningeal trigeminal pathways, with the branches of the trigeminal nerve being close to these small leaky blood vessels in the bone marrow of our skull.